Welcome to another episode of Easy Access to Healthcare for All, a program which brings you news and issues around the National Health Insurance Scheme. Attaining 90% universal health coverage by 2030 is one of the major goals of the NHIS. What this simply means is that the NHIS has a mandate to ensure that 90% of Nigerians are covered by one form of social health insurance by the year 2030. In order to do this, amongst other objectives, the new management has drawn up a 10-year strategic plan. What is this plan? What does it contain? And how far with the implementation? These and more will be our focus on today's episode of the program. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. Our top story reports a meeting the agency had with drug management agencies. These and other stories in our news diary. Keep watching.
The Medicine Supply Implementation Committee of the National Health Insurance Scheme (NHIS) has met with the drug management agencies (DMAs). The meeting, which took place in Abuja recently, is in line with the Medicine Supply Initiative as conceived by the NHIS. The meeting had in attendance the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, the Chairman Forum of DMAs, the Director of Food and Drugs of the Federal Ministry of Health, Pharmacist Mrs. Olubumi Aribiana, amongst others. In his opening remark, the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, mentioned that the idea of the Medicine Supply Initiative is to make drugs affordable as well as available to all Nigerians.
Following the engagement with the drug manufacturers, an idea came in where we established a committee that will work to develop this NHIS drug initiative. It was a multi-stakeholders committee involving Ministry of Trade, Ministry of Custom Services, state health insurance agencies, committees of medical directors, HCPAN, committees of healthcare providers in Nigeria, and many other stakeholders.
Professor Sambu added that the NHIS is in no way aiming at taking away the powers of any agency or organization involved in the process. Also addressing the DMA's General Manager, Standards and Quality Assurance of the NHIS, Dr. Yakubu Agada called on the agencies to study what the NHIS has done and make their input in the interest of all Nigerians.
We want the DMAs to really come out and study what we have done and make their input. And to also say that the Ministry of Health has really been cooperating with the NHIS, and any moment from now we are expecting the approval to be conveyed from the Ministry of Health to NHIS for the effective commencement of the program.
In separate interviews, Executive Secretary of the NHIS, Professor Nasir Sambu, and other stakeholders provide further information on the Medicine Supply Initiative.
There are two major importance of this initiative. One, you will have availability of drugs that are qualitative, and you will have drugs that are cheap, because the manufacturers association, group of manufacturer associations, are willing to partner with NHIS to cash or to leverage on the quantity, scale of quantity. The higher the quantity, the lower the price. So through this initiative, if we say we have millions of people in NHIS ecosystem that are utilizing drugs, and we are ready to partner with these drug manufacturers, and they are assured that they produce drug in quantity and the prices will go low, then they will subscribe into it.
The NHIS Medicine Supply Initiative is targeted at curbing issues of affordability, accessibility, quality, and the whole drug security for NHIS enrollees.
We're working together in collaboration with the NHIS to ensure that drug supply is available in all our accredited facilities to our enrollees at an affordable cost. That is what we're doing. We're working together, we're in sync.
The National Health Insurance Scheme (NHIS) has said that the scheme is not for government workers alone but for all Nigerians. The Executive Secretary NHIS, Professor Nasir Sambo, made this known at the recently concluded 2021 Lagos International Trade Fair. Professor Sambo, represented by the coordinator of the NHIS Lagos Zone, Mr. Femi Akigbade, said NHIS has introduced a program for all families to benefit from the insurance scheme. He said that the program named groups, Individual and Family Social Health Insurance Program GiftShip, was launched in November 2020.
The National Health Insurance Scheme, like we all know, was created by the Act of Government in 1999, Act 35. And one of the main things that it's supposed to achieve is to make sure that all Nigerians, irrespective of your social status, is covered under one form of health insurance or the other.
Mrs. Kapung Eteng, a brand ambassador of the group Individual and Family Social Health Insurance Program GiftShip program, gave attendees more insight into the program.
The individual package, and it costs 45,000 naira per annum. Not per month though, per annum for 1 to 3 individuals. For family, a family minimum of 4 persons, up to 9 people. The minimum is 60,000 naira per annum, and each additional family member, 15,000 naira. This package consists of preventive, promotive, curative, and rehabilitative services for all the enrollees. This package is one of the best in the world.
The program is easy access to healthcare for all. Someone said, a goal without a plan is just a wish, and that is a fate that cannot be allowed to befall Nigerians' plans to attain 90% universal health coverage by 2030. It is towards turning that goal to reality that the NHIS drew up a 10-year strategic plan. In our next segment, Issues Around the NHIS, we shall find out more about this plan and how it would help in giving all Nigerians easy access to healthcare. Do stay tuned.
Easy access to quality healthcare for all. NHIS.
The National Health Insurance Scheme (NHIS) was created to grant easy access to healthcare for all Nigerians at an affordable cost through various repayment mechanisms. This was in line with the United Nations Resolution on Sustainable Development Goals (SDGs).
If you look at the SDG 3, it's talking about universal health coverage. Every country must work hard assiduously to ensure that no person is left with respect to provision of basic healthcare provision fund. So if you look at the agencies that are working towards attainment of universal health coverage, NHIS is the leading agency.
After being operational in 2005 with the presidential mandate to achieve universal health coverage (UHC), less than 10% of the Nigerian population was covered as at the year 2019, leaving out most Nigerians and prompting the creation of the Basic Healthcare Provision Fund.
But you cannot achieve universal health coverage when you have the large chunk of the population not being integrated within the health insurance. That is why I discuss about the Basic Healthcare Provision Fund, an initiative of the federal government to increase the fiscal space to ensure that the vulnerable segment of the population also come into the national health insurance ecosystem.
Still in line with attaining universal health coverage, the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambo, when appointed in 2019, received a mandate to develop a comprehensive 10-year strategic plan, amongst other things, to reposition the NHIS and accelerate progress towards universal health coverage. That being the directive, the management of the NHIS, under the leadership of Professor Muhammad Nasir Sambo, set up a committee comprising of staff of the NHIS and stakeholders that designed and presented the 10-year strategic plan, with the purpose to define a future direction for repositioning NHIS for efficiency and better performance, and outlined measurable goals for achieving universal health coverage. The document also outlined how to achieve these goals.
We have developed a 10-year strategic plan, which will create a very clear direction for the development of the national health insurance and health insurance in Nigeria in general.
10-year strategic plan of the NHIS is a blueprint or a roadmap of how the NHIS intends to provide comprehensive health insurance to every eligible Nigerian in the next 10 years. It is a guide for the organization that tends to show how the NHIS, under the leadership of Professor M. Sambo, is going to reposition for efficiency, for effectiveness, in order to ensure that every living Nigerian has access to affordable and quality healthcare. The 10-year strategic plan is necessary because, number one, it gives direction to the organization. It also serves as a guide for every stakeholder working in the health insurance industry to have a common direction, a common vision, and a common purpose towards ensuring that we all work in alignment with each other to ensure that we provide our main purpose of existence, which is health insurance for all Nigerians.
This would be the first time the NHIS would have a strategic plan to guide its operations. And in designing this plan, the management of the NHIS invited all hands on deck in order to come up with a plan that would prove to be effective as well as long-lasting.
So we had a series of engagement with various stakeholders, where we discussed in detail the process of the strategic plan. We got some resource persons from outside, and some development partners also supported in the process, like the Life Fair project. They also supported in this process to ensure that that buy-in is there. And also we had series of workshops with the staff and the various stakeholders, and an in-house task team was formed comprising of staff from all the various departments in the agency.
The pillars of the strategic plan include accelerating the attainment of universal health coverage through 90% coverage of the populace with health insurance by the year 2030, ensuring substantial pooling of resources to guarantee adequate financial risk protection from catastrophic health expenditure for all enrollees, enshrining good governance, strategic communication, transparency, and accountability within the National Health Insurance Scheme with strategic communication, ensuring that equity remains a priority in the programs of the National Health Insurance Scheme, and that vulnerable groups have financial protections while accessing healthcare services, and fostering strategic purchasing of healthcare goods and services with a focus on increasing efficiency at all levels. The strategic plan hopes to aid the NHIS in areas like agenda setting, to set direction and establish priorities towards achieving universal health coverage over the next decade, result-focused, strengthening programs, operations, quality assurance, administration, and all departments to achieve NHIS goals, streamline decision-making, identify priority activities necessary for success, aligning resources with priorities, mobilization of resources for better alignment to maximize NHIS strategic success, strategic communication, communicating NHIS vision and mission to all stakeholders. With a development plan on ground, the next step the committee took was getting funding for its implementation.
After that, we did what we call financial sustainability analysis. Okay, we have developed this plan now. What is the financial implication of implementing this plan, and where are these resources going to come from? We did that mapping, and then we did what we call an investment case. Building an investment case means that we are going to get a compelling argument. Okay, what is the reason why government should invest in health insurance expansion in the country? And we are able to show with tremendous results that if you invest in health insurance, there will be tremendous reduction in the maternal mortality, infant mortality, under 5 mortality indices in the country. One very important result is that if 90% of Nigerians are covered with health insurance, 50% of the under 5 mortality, that's children that die below the age of 5, will live. So that is a compelling argument to really place the government that investing in health insurance will go a long way in solving some of the key maternal, child and neonatal mortality indices and problems that we have in the country.
In the implementation of this plan, the NHIS alongside other stakeholders are there to see to its success.
The state social health insurance agencies are also very important stakeholders, because they also have the responsibility of implementing health insurance at the grassroots, at the state level, and the NHIS is giving them the coordination and the guidance. But also the state health insurance agencies are supposed to domesticate this plan, and already some states have started the process. I know Kano has started, and I have a request right now for Kaduna that they want to also domesticate the plan. Most of the states also have expressed interest that NHIS should come and support them to domesticate this plan. So this is a plan that is not only guiding NHIS, but also the state health insurance agencies to implement health insurance in the country. Other stakeholders are development partners, who are also going to bring in their resources and their technical expertise to support this plan. Of course, the civil society organizations, media, legislators, and the rest are all stakeholders who, in one way or the other, contribute to this plan.
The ball has been set rolling on the implementation of the 10-year strategic plan. Actions taken so far include professionalizing the NHIS, human resource, creation of the eNHIS, creation of the giftship program, and a whole lot of restructuring towards the target. This is even as mechanisms to monitor and evaluate these implementation have already been put in place.
The 10-year strategic plan has aggregated all these initiatives that we are putting in place, strengthening our offices, doing this thing, creating giftship, how many people can be covered in giftship within a first year, within a second year. So the implementation process has commenced.
Already all our this year's budget is developed from the 10-year strategic plan. We have also put in a mechanism to monitor and track implementation, and we have also developed what I call an accountability framework for the 10-year strategic plan. So we are going to hold departments, divisions, units, and other stakeholders responsible, for implementing this plan. And we are going to work collectively with all stakeholders to ensure that, we implement this plan to the latter.
Welcome back from that timeout. Defense Health Maintenance Limited is a health maintenance organization for the military. Established in 2012, Defense Health Maintenance Limited manages the healthcare of military personnel, both serving and retired, as well as that of civilian staff working for the military. It is the largest health maintenance organization in Nigeria, with branches in all 36 states of the Federation and the FCT. In our stakeholders segment tonight, we had a chat with the MD CEO of Defense Health Maintenance Limited, Sergeant Rear Admiral A.B. Afolayan, retired. As a stakeholder, Rear Admiral Afolayan described the intervention of the NHIS from a personal angle.
Fantastic, because with nostalgia, I could remember as a junior officer in the Nigerian Navy how health services are. People out of pocket expenses, and you have to apply for reimbursement and all that. But with the coming of NHIS, I remember we started, the military kid in 2006, and I was then the commander of a reference hospital at Ojo. So it was a very welcome development. It allows more access to health. More people who were coming in, and at least at the primary care level, they were doing very well.
What are the specific roles the HMOs play and their responsibilities to enrollees under the NHIS arrangement? Rear Admiral Afolayan explains.
The roles of HMOs are clearly stated in the guideline. One, they manage the fund accrued to them for managing the health care of enrollees. Two, they ensure that prompt payment of funds are made to the HCPs for continuous flow of work. Three, the process what they call fetching of secondary care submissions to the by HCPs to them, again for prompt payment. Then quality assurance, they do monitoring and evaluation of the HCPs to ensure that they meet the need of the enrollees. For the enrollees, the HMOs need to ensure that the enrollee is happy with what it receives at the healthcare providers' places.
Rear Admiral Afolayan also speaks on some of the challenges hindering the NHIS from achieving universal health coverage. He makes some suggestions on how to overcome those challenges.
And for expansion, like I said, it has to be made compulsory. Government has to do more on health infrastructure development, capital development, and then motivation. Motivation in terms of good remuneration for our health workers, so as to retain them and then let them do the work.
That was Rear Admiral A.B. Afolayan, MD, CEO, Defense Health Maintenance Limited, speaking from his experience as a stakeholder in the implementation of the NHIS. We will now take your questions in our last segment of the program. Don't go away.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: what should enrollees do if prescribed drugs are out of stock?
Out of stock is not a part of NHIS, so it shouldn't have even arise anywhere. All right? As long as the NHIS has a drug list, which every facility that is under NHIS should have. Nobody should tell anybody that a drug is out of stock. It's not part of NHIS. And it's not good. Because what we are seeing now is that the healthcare providers are trying to make Nigerians begin to suspect that NHIS is not really, and we are hearing it everywhere. Yet, one thing is that these guys are paid upfront. So, and when you come into NHIS and sign a contract, an agreement to abide by the guidelines of NHIS, there's no need to tell anybody that is out of stock. So, and that is just what we have to say for now.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. Join us again, same time, same station, on another episode as we continue to bring you more stories of happenings around the NHIS. Universal health coverage for all Nigerians is a possibility. Enjoy the rest of your day. See you next week.